Health equity is extremely important to help us understand and better address health disparities. You know, disparities are differences in outcomes of health for different folks that really aren't explained by medical reasons. And we know that because of these different disparities, we spend almost $93 billion every year in the US on either wasted health care or care that could have been less expensive had it been received at a better time. So when talking about health equity, we have to address social determinants of health, which are non-health factors that ultimately influence health outcomes. These include things like where you live, if you have access to transportation, if you have access to food, stable housing, clean water, all kinds of factors that really have nothing to do with the moment that you're in the provider visit, but are ultimately going to drive about 60 to 80% of your outcomes. So we can't really talk about equity without addressing these variety of factors that are leading to these inequities. Data is so critical to understanding what's going on and to figuring out what we need to do, and also to help build educated and structured plans that have a good likelihood of success. So it's amazing for me to say that there's a huge gap in knowledge of race, ethnicity, and language for most people in the healthcare system. Obviously, they know their ethnicity and their race and language, but getting that information to us in a way that we can use and then track to match with outcomes is surprisingly difficult. And so a lot of efforts right now are focused on getting this high quality individual self-reported data so that we can then see what the outcomes are and look at different groups and identify where the disparities lay.